Community Board 10. Can you hear me?
Okay.
Hi, good evening, everyone. My name is Dominic Boyce. I'm the Chair of the Health and Human Services Committee. Welcome to our Monday, June 16th meeting. At this particular time, as while some of our members are still arriving, we're gonna go around the room and have our committee members introduce yourselves, starting with to my immediate left.
Oh, all right. Hi, good evening, everyone. Karen Dixon, member of the Health and Human Services Committee, and the Personnel Committee, and then Chair of the Land Use and Housing Committee.
Hello, good afternoon. Juanita Anderson, CB10 staff.
Kamara Johnson, of this committee and also the Education Youth and Libraries Committee.
Donna Marie Gibbons, member of the Health and Human Service Committee and also the Transportation Committee.
We're gonna move to our members, committee members online, starting with Donna Gill.
Good evening, everyone. Donna Gill, committee member and senior task force and government and budget committee. Welcome.
Thank you. Next, we'll go to our vice chair.
Hi, good evening. Catrice Davis, Vice Chair of the Health and Human Services Committee and also a member of the Education, Youth, and Libraries Committee. Sorry I couldn't be there in person tonight.
Any more members online?
No.
No, okay. At this particular time, a new arrival.
Hi, I'm Daniel Patterson. I am Chair of Transportation, Landmarks, and Historical Preservation. I'm also a member of this. Thank you.
Are there any, at this time, any general board members online? If not, I'm gonna move to those in the room to introduce themselves who are non-board members. Michael McCray,
Sheila Innes.
how you doing? And your organizations?
I'm the founder of Harlem with Glamour Style. It's a channel about positive stories of people of color.
Okay, thank you. We're gonna move to those online. Start with Deborah Levine.
Good evening, everyone. Deborah Levine, Community Engagement Officer for City University Graduate School of Public Health and Health Policy.
Our next person online, please. I think it says Carrie Booker Searcy.
Yeah, my name is Charles Cersei. My wife put this together, so she put her name up there. And I'm with the BIR, Brothers in Recovery.
Okay, great. We'll come back to you.
Okay.
Next is Ms. Conrad.
Hi, my name is Raquel. I'm an undergraduate student researcher at Columbia, here to talk about my research project.
Thank you. And to her immediate, is that
Nancy Padasala.
Hi, good evening. My name is Nancy Padsala, and I serve as the program manager at Manhattan Staten Island Area Health Education Center.
is anyone else we left out?
Desiree.
Anthony Shaw.
Pretty sure. Okay, and your organization?
Peace and blessing. My name is Anthony Shaw. I belong to the organization called Brothers in Recovery, which is 115th and Edge. I'm one of the director and the chairperson of the Peer Initiative Movement.
Thank you. We'll get a presentation from you shortly. And last but not
Yes.
least, you said, is there Desiree, someone you said?
Yeah, that's the name on there. iPhone 5 Desiree.
Okay, going once, going twice. If not, we're gonna move forward at this particular time. As we don't have any representatives of elected officials, we're gonna move straight into our first presenter, Ms. Raquel Conrad.
Oh, okay. Am I able to share my screen?
Yes.
Okay. Second. Okay. So good evening, everyone. Like I said, my name is Raquel, and I'm an undergraduate student researcher working on a project called the MP3 Initiative. And I'm here today to talk to you all about MP3, what we've done as a team so far, what we still plan to do, and why it all matters. Sorry. Okay. So as an introduction, MP3 is short for Morningside Park Pond Project, and it's an initiative that aims to reduce the harmful algal blooms in Morningside Park's pond, solve the issue of park flooding, and generally make the park more sustainable. As for what we've done so far, we've restored broken pumps in the park, fixed the pond's waterfall, and conducted surveys that were used in modeling the park. As for restoring the pumps, our primary motivation in restoring the pumps was the need to address the malfunctioning pump waterfall system, which arose from pump damage. We took out the existing pumps, disassembled and cleaned them, checked to make sure they were up to standard, redesigned them, and then ultimately put them back with the redesigns in place. As a result, the pumps, which now have variable frequency drive, which means they can run as fast or as slow as needed, they are now less prone to experiencing mechanical stress, and they were designed and are prepared for park flooding events. Related to the restoration of the pumps, the restoration of the park's waterfall was another major milestone for us. Given how beloved the waterfall was, we were eager to get it up and running again, which we did after repairing the pumps that drive its flow. More on the engineering side of our project, it was also important for us to survey the park over the course of a semester in order to obtain an up-to-date model of the park's landscape. This was necessary as we needed to address the impact of the landscape on recurring floods. These surveying expeditions ultimately allowed us to make fairly accurate models for the park, one of which is in purple to the right. Now, you may be asking yourself, why does this matter? And I'll answer. For starters, as I mentioned before, this initiative has an overarching goal of making Morningside Park more sustainable. In a world where harmful algae and climate worsen flooding affect both natural ecosystems and humans, sustainability is more important than ever. Moreover, one of the key tenets of environmental justice is the importance of those most impacted, i.e. marginalized communities, in participating in justice efforts. Unlike other New York City parks, Morningside Park doesn't have a conservancy that can fund major undertakings in the park, but Harlem and its residents deserve to have a park that's up to par. Finally, this initiative matters because of restoration. Not only the restoration of a key Harlem landmark, but also restoration as it involves the harm that Columbia has and continues to enact on Harlem. We as a team don't want to perpetuate this harm through our work. Which leads me into our plans for the future. In or around September, our team will be conducting a LiDAR drone survey that can collect survey points with more precision and at a much higher rate than humans. So for instance, where humans took a semester to survey 40 points, LiDAR will take less than a day to survey 40 million. Once this survey is completed, we will use the data obtained to improve existing models of the park. And finally, our ongoing plan for the future is to continue community engagement. In the spirit of including the Harlem community in our work, we're working to both partner with community groups and engage with the Harlem community in talks like these. Our hope is to get valuable feedback from the people directly impacted by our work, rather than to act as another predatory Columbia force. Any questions?
Yes, thank you for your presentation. A couple of things. One, well, in terms of full transparency, I live right across the street from what you just described, that park and everything like that too. And one I want to start is that actually, and I want to make sure when you reach out to all stakeholders, that's actually in the province of Community Board 9. And so that's the first thing. So I'm hopeful that you have already reached out to Community Board 9 If not, we can give you contacts for them, but as community board now. And the second thing, you did mention, there's not a conservancy, but there's a Friends of Morningside Park group that works to, improve the park and everything like that. And again, in full transparency, my wife serves on that board. So, and I know this conversation came up about the pond and the lake and the algae and stuff. So again, that's another partner that you can work with in terms of addressing this, because it's a beautiful park, beautiful lake. The waterfall is working and everything like that. So these things are important. So we want to steer you in the right place. But my primary question is, when you say we Columbia University, are you talking as a member of the institution, or is there a student group that you're referencing right now when you're giving this presentation that's responsible for the pumps and everything? I think it needs to be more clear who is responsible for the fixtures.
Yes. So my research team, we all attend Columbia or are professors at Columbia, but responsible for the park initiative itself is the research team, not Columbia as a university. So it's just us, mostly students, working on that.
But it's tied to, is it tied, excuse me, I'm sorry, Ms. Conrad, thank you, that was very informative. Is the research project tied to something that will be presented to a class in Columbia? Or it's
Um,
separate?
it's separate. It's somewhat independent. It's mostly connected to Columbia through Carleton Lab, which is a civil engineering lab at the school.
Okay,
Yeah, not specific to any class or anything,
thank you.
of course.
I had just a really quick question about anything that you picked up in your research on the kind of like near term or long term consequences of climate change for that part. I mean, what kinds of things are you all forecasting? It sounds like more flooding perhaps in the future, but anything else coming up based on what you all are modeling?
Thus far, there hasn't been much research into future climate impacts, but more flooding in the future is definitely expected if we don't take care of it now. Um, Probably worse pollution in the pond as well. Um, Mainly those two things for scope.
Thank you.
And we'll take another question here, then we go to the members online.
One more question, Ms. Conrad. This is really a land use question. Do you know if this park is anywhere near the floodplain?
When you say the floodplain, what do you mean?
So there are areas in Community Board 10 that the floodplain, they've been in the floodplain, and over the years, we see it continuing to move deeper and deeper into the community, i.e., for instance, Malcolm X Boulevard on 145th Street, the park is in the floodplain, and then it's moved over, so it's right now on the other side of the street, on the downtown side. So I was just curious if there was any data that you all had procured about it potentially being in the floodplain, because that would then add on to whatever other flooding may be happening in the park. So I was just curious.
That's a great question. I am not entirely certain, but in my next slide, I have a Google form for questions that can be submitted, and you can ask it there, and I will follow up with you as soon as I have an answer to that.
Thank you.
Right. Are there questions from board members online, virtually?
Yes, how long has the project been underway, and what is the duration of the projected duration of the project?
So this has been underway since last year. Projected duration, I'm not entirely sure. It will probably be continuing after I graduate in the spring. Um, but yeah, just until we're able to get sufficient models of the park. We're also waiting on models of the piping below the park. And basically, until we figure out a solution that's sustainable and in line with what Parks wants, that is sustainable and addresses the flooding. So it could be ongoing for a while.
Thank you.
Any other questions from anyone online? So I have another question. And with respect to this project, have you met with stakeholders like the Parks Department?
I haven't personally, but our project lead, Dr. Bruger, has. He has various contacts in New York City parks that he has been working with. I haven't met with him personally yet, but he has, and I can maybe put you in contact with him if you wanted to ask more something on those lines.
And my second question, because there is life within that lake. There are turtles, there are geese. What have your research found so far in terms of the impact on the wildlife and the animals that are there?
Definitely that the algae is harmful to the existing wildlife in the pond as well as to humans. But my team specifically is the water team, which deals more with flooding in the park, and there's another team that deals with the algae blooms. So I can take that question. I will note it down. If you send it or submit it in the Google form that I have, I will be sure to get you a more detailed answer. But yeah, that's less of my team scope.
Is the Google form in the chat?
It is right here, the QR code.
Oh, the QR code. Okay. Any other questions from anyone? No. Okay, and so will you be coming back to us in the future to give us an update?
I definitely can, yes. I would love to
Okay.
do that.
Please.
Okay.
Go ahead. Liz.
Okay, someone has their hand raised.
Yeah, thank you, Rachel. That was excellent presentation. My only question is the sustainability of the project, because you said you will be gone in the spring. So is there a group of people that's taking this on, and just to be mindful of what the chair said about the the organization for the park that his wife is a member of. I don't know if I think it would be best to reach out to them, just so going forward, this project could be sustained. So my question is the sustainability question.
Yes. So Professor Bruger, who has been working on the project as the project lead, he will keep it going after I graduate. We do have contacts in Friends of Morningside Park. We've reached out to them. I'm newer on the project, so I'm getting introduced to them. But Dr. Bruger has been working with them. Community Board 9, we are planning to reach out to them and maybe speak at their parks committee meeting next month, I believe. And one of the other main students working on the project, she's also a senior like me. But this project is open to students throughout Columbia. So more will be joining after we leave.
And it would be helpful to
I
also
have a
reach
follow.
out to.
I'm sorry, I have a follow-up to that, because you said you're going to be reaching out to Community Board 9. You have to be mindful that the community board goes from September to June, and they're usually not in session in July and August. So that may be something you may want to think about. You may want to reach out to Community Board 9 now and not wait for a committee meeting if it hasn't already happened, just to find out, to give them this information. Sorry, Dominic, I didn't mean to cut you.
It's okay. I was just on that point too. You may also reach out to the Marion Borough President's office about this matter, as well as elected official Shauna Brew, who covers that park in that area on the side of Morningside. So this is important. This is information that all these stakeholders need, because they can help and assist with these projects and with funding to fix, the algae problem as well as any problem in the future with the pumps.
Okay,
Does that make sense?
noted. That does, yes, thank you. I think I got the date wrong for the Community Board 9 meeting. I thought it was next month, but it might be this month.
Okay.
But yes, we are planning to see if we can speak at that one as well.
Thank you. Thank you for your presentation. And
Thank you.
have a good evening.
Did everybody have a chance to scan the QR code?
Oh.
Is it part of the slide that was sent to the manager? Yes, okay, so we'll get it and send it out to the members.
Okay, thank you.
Thank you.
At this particular time, move forward. We're gonna move to Ms. Pat Sala and her presentation, Manhattan Staten Island Area Health Education Center.
Hi. So I don't have a presentation prepared, but I just wanted to introduce myself again. My name is Nancy Patsala, and I serve as the program manager at Manhattan Staten Island Area Health Education Center. We're located on 126th Street, and we are part of 9 other statewide AHECs, which are all around the New York State and also all around the US. So it's a nationwide nonprofit organization program. And in the Metro New York, we have 3 locations. So our center, we work with students, schools, and hospitals located in Manhattan and Staten Island. Primarily, we serve the students who live or go to school in Manhattan or Staten Island. There's other location which covers Brooklyn, Queens, and Long Island. And our sister organization, which is Bronx Westchester AHEC, we work very close, and we have similar programs. So I just wanted to share a little bit about the programs that we offer. We have a summer health internship program, which serves students, high school students, juniors and seniors, and college freshmen and sophomore. So we place them in a clinical site in underserved community. And these students get experience in what it's like to be in hospitals and work with people of color. And so our mission is to improve the healthcare access and equity in underserved and disadvantaged communities. So these students work with us for 6 weeks during the summer, and they also get a stipend. And in the end, they all come up with a research project, which is presented on our closing ceremony. We have another program, which is kind of similar to the summer health internship program, but it's called Healthy Communities Internship Program. And it's also 6 weeks. It is for college juniors and seniors and grad school students. And we place them in non-clinical settings and other community-based organizations to get them exposure that there's more to medical field other than being in a clinical setting or a doctor or a nurse. So they work with opioid overdose centers, or they work with organizations that focuses on maternal and infant mortality. So all these different non-profit and non-clinical organizations. So another program we have is AHEC Scholars Program, which is primarily for students who are in their last 2 years of health profession degree. And they need to fulfill, it's a 2-year-long program in which every year they have to finish 40 hours of in-person training, or they work in again, an underserved community. They fulfill those hands-on hours, hands-on experience hours, and another 40 hours of online based training, which they can fulfill on their timeline. And this is also a stipend-based program. And lastly, we have an opioid prevention and education program where we provide free trainings to people, and they learn how to prevent someone who is overdosing through opioids, or they can identify signs of someone who's addicted to opioids. And so we also provide them a free Narcan kit. And it's a very good program to help them develop these skills and develop these skills to potentially save a life. So it's a free training program. We work with people who would like to schedule these based on whatever their availability is. So I'll put my number or my website and all the contact information in the chat. And if anyone has any questions, I'll be happy to answer them.
Thank you for your presentation. The first question is, you mentioned your location. You just said 126th Street. Can you give us a complete address so we can know which locale and area on 126th Street that your organization is located?
It's in Central Harlem. It's right behind CUNY School of Public Health. It's
Right, but what's the address?
8 West 126th Street.
Oh, I don't have any questions.
Any questions from the committee members?
Donna, Gil, and Patrice have hands up.
Committee member Gill?
Yes, thank you for your presentation. This program sounds really interesting. My question is, you didn't specify an age as to, who is eligible for the program
So
and things like that.
yeah, so all the programs they focus on different age groups. The youngest one we have is the summer health internship program, and we take students from 16 or above, but they have to be a rising high school junior or senior, and college freshman and sophomore. We also have programs for college juniors, seniors, and med school students, but they depend which program they're applying to, and all programs have different eligibility. And I can provide the link to our organization so you will have a better idea about the timeline of the program, what it consists of, and the eligibility criteria.
Thank you.
Vice Chair?
Thank you for this presentation. It was a lot of great information. Has a deadline passed for the summer health internship program?
It did. The two programs I mentioned are about to begin next week and the week after. But currently we do have opioid prevention and education program that we're open to, providing trainings and also schedule tabling events if possible.
Okay, and you're going to provide your contact information if we are interested in reaching out
Absolutely.
for the training. And in general, what is the deadline for the summer health internship program? Just so we can put the
Usually
calendar
it
for next year.
is, so our early bird application opens early November, and the deadline for the early bird application is January, end of January, and then the regular applicants, they can apply February till mid-March.
Thank
So
you.
the only difference is the early bird applicants get a little bit higher stipend comparing to the general applicants pool.
And you'll put that information in the chat as well?
Yes.
Okay, thank you.
And I'll also be there tomorrow in the committee meeting, and hopefully I'll have better presentation.
My last question is, how long have your organization been located in Harlem at that site?
So the current site, we've been there since 2018. We've been around since 2008, I believe. I recently joined the organization. I'm not very much sure, but I'm pretty sure that we were there since 2018 at the Harlem site.
Do you know if this is the first time you guys are presented to community board?
Yes. I mean, no. My the program manager who was here earlier, she used to come for the committee board meetings. That's what the center director told me, but this is my first time attending one.
I was just gonna ask if you all cover mental health as well, psychiatry, psychology, therapeutic work, that kind of thing.
So we, for the summer health internship program, we work with different hospitals. And so they decide where the students are placed. Like, for example, some hospitals have an age criteria that only 18 and above can go to emergency department. So they will choose those students, based on their age and all of those, if they're meeting their requirements. And some hospitals do have psychiatry and mental illness focused areas that they connect the students with.
Thank you.
So our goal is to, expand our organization. I believe that we do some great work, and so, but we're very small. It's just me and my center director. And so we're just trying to expand ourselves and, provide these opioid trainings and recruit more students and connect with schools and hospitals so we can do this more for these students.
So when you talk about expansion, are you looking to hire more staff to work with you and your center director? Or is it just about expansion of the programs that you mentioned tonight?
Expansion of the programs, about the staff, I don't cover that area, but we are looking for someone potentially to join us in these programs because right now I cover all the programs, and my center director, she just guides me. She does more of fiscal work, so we are looking for someone who would be able to, take over some of these programs, but we are looking to expand and let our community know that, hey, we're here and we provide these programs. We can connect your kids, we can connect to whoever you want to get these experience, because I feel it's not everyone gets this opportunity to get this kind of internship or experience before and know, like, okay, they want to go in med school. Based on our programs, the stuff we offer, they can learn that they want to be in medical field or not. So it's a good exposure, I believe.
Thank you. Are there any more questions from anyone?
Yeah, I still have a question. Dominique, thank you. It's related, this is Donna Gill, it's been related to this. I was gonna ask, what kind of outreach are you doing so people can find out about this information? Because this is the first time I'm hearing about it, and you've been here since 2018, which is shocking to me. And secondly, I would think, I don't know if someone could correct me if I'm wrong. I would think if you want to reach students, you may want to present to our Education, Youth, and Libraries Committee, because that's one way where you can be connected with schools and parents and actually, schools. So our chair of that committee, Miss Stephanie Palmer, I guess you could get her information or they can share that information with you. I don't know if they've met already this month, but I think, it would be a place to start just to get people, get students for the program.
Young lady
Catrice just said that they meet tomorrow. Did you say, or Wednesday?
Tomorrow.
So, it would be nice if you can do that, because I feel like this is a great opportunity for students in our area. And I feel like it's something that they're not really, they don't really have this information. So they don't know that you guys are right there on 126th Street. And these opportunities are wonderful for students. My other question was about the fields, because I know you're talking about not being doctors, non-traditional, going into medicine, because not everybody is going to go to med school. I mean, there are other fields in the medical profession. that are available for students.
Mhm.
And, you know, I was wondering if your program also exposed them to lab technology, X-ray, you know, those other things that are in the medical field that are available for our youth to go into.
So I don't know if the hospitals that we work with provide these specific positions, but I put these job opportunities on our website where students can check out these partner events that are happening in our community, and also, you know, work post job openings for, I know these students, like especially high school students, might not be as experienced, might not qualify for these positions, but I post these job opportunities about the lab technician that you just mentioned, and we I don't think that there is specific position that the hospital provides. They just get exposure to like maybe assisting the doctor, but it would depend on the hospital as well that we connect them with. If you know they're very open to students getting these experiences, then I think they do provide, but they might not just put it out there. Like they might not tell that, okay, this is what we're hiring the student particularly for. So they work as volunteers at their hospital. So whatever the hospital chooses to expose them to, that's what happens over there. So I don't think I did I answer your question?
Yes, you did, but I just have one follow-up question.
Sure.
Could you give us a list of the hospitals that you work with?
Yeah.
Is that possible?
Yes.
Okay, thank you.
Yes,
Mhm.
and to answer your question, I will be there in person tomorrow for the Youth Library and Education Committee.
Thank you. And just also too, since you're going to just make sure you should contact and set a meeting with the superintendent of District 5 on Sean Davenport office, to talk about these opportunities with children, particularly here in Harlem. So again, we thank you for coming and presenting, and make sure we get all your information so that we can have it here in our district office.
Yes,
Thank you.
I
Ms.
think
Davis.
Davis.
I'm sorry, I just had one final comment just to kind of piggyback off of what the chair just said. Many of our District 5 schools are participating in apprenticeship and internship programs through either Future Ready or Modern Youth Apprenticeship. So that is definitely a valuable suggestion that was just made to make contact with the superintendent and deputy superintendent of District 5.
Got it. Okay. Thank you.
But also we have District 3 in our district as well. So we need to get the superintendent from District C3. We all talk about District 5, but we have two districts that are in our catchment. Thank you.
Absolutely. Great
Yes,
catch.
ma'am.
Thank you for
Yes, yes.
presenting. Before we move on to our final presenter of the night, I just want one of our newest board members walked in. We did introduction, so I'll ask her to introduce herself and also what other committees she's serving on, please.
I am so sorry. My apologies for being late. I went to the state office building. Yes. Okay, so I'm new, so I'm very sorry about that. And my name is Brenda Jones, and I am serving on this committee as well as education. So I'm very happy to help out.
So she has a great segue to tomorrow. It's good to see you again.
Yes.
Great, thank you. And also, I just, before we move to our last person, I want to recognize again, go to Deborah Levine again. Is she still here?
Yes.
Yes, Chair, what can I do for you?
How you doing? Good,
I'm
good.
good. How's everybody tonight?
One, I just wanted to acknowledge you for that wonderful program that you did, the COVID Memorial. I just want to give you opportunity to bring people up to speed on what transpired and what came out of it, if you don't mind.
I would be happy to take a really quick minute. I'm dropping a link into the chat for everyone. Good evening. Again, my name is Deborah Levine. I'm your Community Engagement Officer for the City University Graduate School of Public Health and Health Policy. Just want to quickly say thank you again for partnering with us to install Trace, which is a multimedia experience honoring frontline staff and delivery folks during COVID, and also acknowledging what we call connectors, folks like your chair, Dominique, and Deneen Brown Blackman and Dr. Cheryl Smith, who take it upon themselves to ensure that as individuals, they are helping our communities connect with information, standing up in spaces where voices need to be heard. And so we had what I would consider a fabulous launch. We had over 110 people in the space. All of our elected official offices came and acknowledged, and we had an opportunity to say thank you to these three extraordinary folks and to create a space in the community where folks will be able to come and use the multimedia art exhibit to remind our students and faculty and community to always center our community, and that the least of us earn the most respect for the work that they do. So dropped a link in on a page. We'll be having some more social media that will be coming out over the summer with a ton of pictures. The students created a guidebook to use Trace, and they'll be working on more materials to share. And the artist and the students will also be working on a short video presentation documenting the process of doing Trace and sort of getting the thoughts and feelings of community members about those who served us during COVID. So thank you.
And thank you. I just want to say it was one of the best programs and events that I've been a part of. And so I want to acknowledge you and your team for the work that you did to not just honor the community, those who lost their lives during COVID, because many of us worked there. We know firsthand how devastating it was. And so one other thing I just wanted to say before we move on is that one of the things that came out of it is we're going to partner this community board, this committee with Deborah and the School of Public Health so that we can bring a permanent COVID memorial to Harlem to honor all those, not just in Harlem, but New York State that lost their lives. And overwhelmingly it was people of color that lost their lives, particularly in the ranks of essential workers and healthcare workers. So that's something that did come out of it. And so more to come on that. Again, thank you.
You're welcome. My pleasure. It was truly an honor. Thank you.
And now we're gonna get our final presenter, Mr. Anthony Shaw.
Good evening. Peace and blessings to each and every one of you. Thank you for letting me come to present this evening. So my name is Anthony Shaw. I'm in an organization called Brothers in Recovery, which is a 501c3 nonprofit organization where were founded in 1988, and we're located at 115 Edgecombe Avenue. Brothers in Recovery is a spiritual, recovery-oriented organization where we go on retreats, and we have existing about 300, 400 members. But we want to start a peer initiative, a mentorship program, and we want to come and just share with y'all our hopes, dreams, and desires. So here it is, the continuum, which we're going to call it, is a mentorship program for young adults who are involved in the criminal justice system and ready to enter into either inpatient or outpatient program. We do understand that these individuals have lost their way and are in the need to help to get their life back on track. Our mentorship program will be implementing the core principles of recovery, which is SAMHSA, which is consistency, commitment, and culture. All right, so here it is, the mission. We will provide mentoring to undeserved young adults who have fallen victims to the negative of influence of their environment. We will accept all individuals, no matter race, culture, or religion. We are here to help those who have been faced with discrimination, who have been judged for living in underserved communities and have illicit substance use disorders, or have been involved with the criminal justice system. Right. We offer a solid support network of trained individuals. Our members, trained individuals. The majority of us are in long-term recovery, all right, from substance use disorder and medication. So we have a group that involved to increase the knowledge. And that's what recovery is about, knowledge, learning what not to do. So what not to do. And it's evidence-based. So it's evidence-based treatment. And this mentorship program will help lift individuals and improve their quality of life as they navigate. So here it is, we're going to give them navigational skills, right? In the ups and downs that we have to offer. So we have doctors, we have lawyers, we have people in long-term recovery, we got peer advocates, we got counselors, we got clinicians, we got all avenues to address this. And here it is. It has never been done in the village of Harlem. No mentorship program is here for young adults. None. You may have recovery centers, which is pillars, but here it is. That's not, that's a do drop-in center. We want to give people knowledge about this recovery process, because here it is from experience. So we're bringing this to the community board, because we've been in existence since 1988. And we do mutual aid support groups, we do Zoom meetings, we do all of this, we do spiritual retreat. But now we want to reach out into the community, and we want to focus on our young, underserved youth, and also young adults, right? Also, we got to remember aging in recovery too now. We got some aging in recovery. So we have individuals in our organization that can reach all facets of life, right? So the peer support encompasses a range of activities and interactions between people who share similar experiences of being diagnosed with mental health condition, substance use disorder, or both. So there's dual diagnosis that we know. Some people have mental health disorder, substance use disorder, mental health disorder, co-occurring disorders. We believe self-efficacy in that you can accomplish any task or goal that you put your mind to. The peer support workers and people and persons seeking recovery promotes connections. And here it is, we're going to be resource brokers. Resource brokers. That's what we are, resource brokers. So the peer support workers and persons seeking recovery promotes connection and inspire hopes. We have to inspire hope into people, because if I did it, you can do it. All right. Peer support offers a level of acceptance, understanding, and a validation not found in many other professional relationships. So this is non-clinical. I'm a professional in my field, but here it is, as a mentor, we have done similar things, but at different times. But by sharing their own lived experience and practical guidance, peer support workers help people to develop this through a metamorphosis, through not a change, but to evolve into something. And they're going to create strategies for self-empowerment, right? And take concrete steps, those strategic steps, concrete steps toward building fulfilling, self-determined lives for who? Themselves. My cohort, which is called Cersei, we have already put the blueprint together. We have a pamphlet. We have a blueprint. We are 501c3 nonprofit organization. We just want the community. We want the community to buy into this, because here it is. We have a product. The product is mentorship. I yield the floor.
Thank you for your presentation. My first question is more informational in terms of your organization location. You said it's 115 Edgecombe.
115 Edgecombe, right there on the corner of 140th and Edgecombe. It's a
140
beauty parlor. We're next to it.
So is it a storefront, a building?
It's a storefront,
clubhouse?
yes. It's a
Storefront, okay. So that's my first question. My second question, you said you have the blueprint every day. Is the program up and running or?
We went through, it's not up, the Brothers in Recovery is up and running, but the mentorship program is not. So we're going to community brokers, shareholders, and we're trying to get this hit out going off the ground.
Okay. So do you have specific criteria for those that you're looking to mentor? You mentioned a whole bunch of things, but specific in terms of age, range.
So young adults, so not them. So we're saying from 18 to 80. Because here it is, I work in a program, and we're still getting 70 and 80-year-old individuals in inpatient and outpatient programs.
And so because that's a big age range, what's your capacity to address the needs of those in terms of staff and mentors?
So the mentors and the staff will be the BII members.
And how many members are those at this point?
As right now, we have a listing of membership of 400 and over 400 men in long-term recovery.
I yield. Does any other member have a question?
Is there a specific app? And I'm gonna miss it. Is there a specific app?
Well, I believe the question is there specific acts. I think your acts is that you're looking to get the buy-in from different community stakeholders, and also are you looking for us to refer?
Say that once again.
Are you looking for referrals from the community board? And look for us to promote the program? I mean, what's your acts tonight to the community board?
So we was giving the presentation because here it is, we're not known, and we wanted to come to the community board and say that we are here, and we're gonna start going outreach. So here it is. A lot of us are in the substance use disorder field, and that buy-in, we you know, a mentorship program, you know, just like an after-school program. After people leave the inpatient or outpatient program, they have nowhere to go for recovery. And a lot of people are not into NALAA. So here it is. It's going to be a resource that they can go to.
Thank you. Understood. Any other questions from any other member? Donna Gill?
Always. Thank you, sir, for your presentation. My question is it an in-house program, or is it where you walk in, you know, to have these services?
Mentorship program is a walk-in. And like we're going to be partnering with different organizations, because here it is, myself and Mr. Charles, we're going to go to different inpatient and outpatient programs and say that we're available for individuals to come and get additional support on their pathways to recovery.
And is this a free program, or is there a cost?
The recovery is free.
Mm-hmm.
Recovery is free. It's Medicaid billing when you go to program, but recovery is free.
Okay. Thank you.
We're not going to bill their Medicaid, no. We're going to swipe the Medicaid card. No, we ain't going to do that.
On the same level, have you received any funding to support you in this endeavor? From any entities, or is it just?
We have not got any buy-ins yet. We just want to bring this to the community board and say that we are here, and now we're gonna put boots to the ground.
Okay. All right. Patrice has a question.
Thank you.
Patrice has a question.
Vice Chair?
Yes, what is the structure or proposed structure of the mentorship? Is it on Saturdays? Is it one-on-one? Is it group, circles, etc.? What's the proposed structure?
I will leave that to my cohort. Charles, would you like to answer that?
Yeah, yes, I would. The structure of the program, we would be providing groups, we'll be providing computer classes, we'll be providing access to help getting housing, help getting employment, help going to school, and mental health help. You know, and we are under the impression that if you want to do something in the community, then you have to get in contact with the community board. And that's what we're trying to do. We're trying to go, you know, follow the chain of command. We don't want to jump over nobody. We want to make sure that we get all this exactly right. So we coming to you to let you all know, you know, if it's feasible that we can do this, give back to the community in the community.
Thank you.
Thank you.
Thank you.
Thank
Any
you.
other questions?
And so the information, the brochure that you showed us, do we have that, or can you provide us with a copy of that?
So everything wasn't ready, but now that everything is ready, we will forward it to you. I have the link, I have the community board, what the lady that introduced that I put in, Duana Anderson. I have
Right.
an email, and I will forward her our blueprint plus pamphlet,
The brochure.
the brochure rather.
Thank you very much.
Thank you for having me.
Thank you for having us.
You're welcome. Have a good evening.
All right.
At this particular time, we're gonna go to old business, which I believe we don't have any. Does anyone recollect that we have old business that hasn't been addressed?
The smell in Target.
The smelling target. Okay, so I believe that was your update.
My update? No, I know that was on our old.
Under old business, smelling
Yes.
target.
Mm-hmm.
Believe. I think Mina White supposed to follow up on that. So we're gonna get the smelling target. Okay, we're gonna have to table that because
I'm a witness.
you're a witness?
I'm a
Okay,
witness.
so let's,
I have testimony, the smell, and I don't know what it is. I went experienced it empirically, so it definitely is something needs to be addressed.
You shouldn't be up in Target now.
That's why
That's why this is.
No, I just wanted to check the smell. I know it's-
okay,
Well, the
so,
last time I was in Trader Joe's, which was last Friday, there was no smell. Cause you smell it, it permeates throughout you don't have to go into the stores. It's
in the.
as soon as you walk in,
so you smelled it too.
it's been smelling since it's been in place.
It's still affecting.
Excuse me.
Still affecting her? Okay.
While we talk, we get Excuse me.
Okay, so we have to have a follow-up on that, but that's still an open item. We cannot address it tonight. We got empirical evidence here, but we have to address it at our next meeting. So we'll table that for follow-up. Moving to new business. As I mentioned earlier with respect to the memorial to those who was impacted by COVID, we're gonna be moving forward, working on that, you know, in partnership with CUNY and working with our elected officials to get traction on that. That's an item we're working on, but also to moving as this is usually the last meeting before the summer break. And I know we're having a special meeting that's gonna be called with respect to election, but outside of that, you know, we reconvene in September. as a body and so we should have time to address some of these issues. But the other thing I want to bring to the attention of this body is that another issue that's been raising its head is the whole vaccine issue. You know, with respect to what's happening at the federal level with recommendations for vaccine. Just this past week and a half, the board that, you know, oversaw vaccines and recommendations was disbanded, fired, and completely
Yeah.
replaced
Replace it. Yeah.
with several folks, quote unquote, who are vaccine skeptics and so forth and so on. And so two things that came out of that Health and Human Services and this administration is that one, there's a recommendation that children as well as healthy children as well as pregnant women don't receive the vaccination.
The COVID.
Any vaccination, but primary, they, you know, the thing was COVID, but they talk about vaccination in general. So that goes anti to everything that's been established in terms of evidence base. And so this body is gonna take up and have some town halls to educate the community about this, because as you know, school starts up in September. And this is a big issue in terms of vaccination of children, pediatric vaccinations and stuff. And so now we have an administration that is saying something counter to what we always been taught and learned, and the evidence shows it works. You know, the only way babies can get antibodies is through the mother. And so if you're saying now that a pregnant woman can't get a vaccination, that means, what does that mean for the baby? The baby will have no antibodies, and so that baby will have, you know, negative outcomes and effects. And so I've been asked by a couple of partners to have the community board work with them to put on, you know, a vaccine town hall for the community. And I know in this fiscal year that's ended, we didn't have any event, you know, in this fiscal year that just ended that ends June 30th. And so I would like for us to participate in that, to educate our community and bring the experts, you know, from every level, from federal as well to city and state, into these communities that we're serving here, so that we can hear, people can ask those hard questions, parents, you know, the elderly and everyone else in between, so that we can get, you know, the appropriate data and information as we move forward. And so I'd like to get your input on that.
Dominic,
As a board,
before we go into that, sorry that I didn't say anything when we were talking about old business, but the public health lab and the naming of the lab and those things that we had discussed earlier, I haven't heard anything about naming it after Dr. Dukes or anything like that. So I was just wondering what's the status of that, or if we can find out what the status of that is at the public health lab.
So we will do a follow. That's an open item too, but that actually, yes, that's an open item, because that was an item that went to the full executive board and committee. And so I know as a result of the last month meeting, there were follow-ups sent to the Department of Health and Mental Hygiene and everything like that. So as far as I know right now, they have not provided us with a response. And so again, we have to look at that open item too, but that's an item that falls under the executive committee and everything like that. You know, we're involved in it, but again, that's the body that's taking the lead on it. So I will follow up on that. The name of the public health lab.
Is there a proposed month for the vaccine town hall?
There is no proposed month, because as it's currently in talks, you know, there could be a series of them in different places. You know, it could be a series of 3, you know, throughout the community and stuff like that. So the details hasn't been worked out at this particular time. But the first thing we do before we move forward, I wanted to bring it to the board committee to, you know, to get the feedback and response.
Well, I think that's a great idea, because Donna Gill again, always speaking. Because of the whole vaccine and going back to school, and not even just elementary school, we're talking colleges that require you to have an MMR up to date or have had one within the last 10 years in order to attend classes. So if the Department of Health and Human Services has decided no vaccines, is New York City changing, or New York State rather, because colleges city and state changing their policy, and we need to. I think that having a town hall would definitely. We want to answer some of those questions because you don't want to go in September and figure out your child can't go to school.
The other thing that came up, and thank you for bringing up, is that, if this is the federal government who's setting policy and everything, that state and that too, there may be other ramifications, because if they're saying that we don't need it, then guess what's gonna happen? One unintended consequences is the insurance companies are not gonna pay for it.
May not. May not.
And so that's something we have to look at. And so things that are traditionally been paid for now, because, the federal government, who covers, Medicaid and Medicare and so forth and so on, is saying, well, it's not necessary, it's not needed. Then, one unintended consequence is commercial insurance would say, well, we're not going to cover it. You have to pay out of pocket for it on your own. And so these are the things that we have to be prepared for as a community, as we see the dismantling of safety net systems, and health is one of the major ones, and everything like that too. So this
COVID is coming back.
so it's important. It's not just COVID, it's a lot of things.
A lot of things.
So, Ari, go ahead.
Yeah, but I'm saying is the federal government wants to remove the CDC's ability to act on certain things from a policy perspective. They want to put it into FDA, which is FDA licensing.
Exactly.
Thing.
So it won't be scrutinized, right?
So the thing is, if the FDA wants to do something, there's no
Oversight.
substantive information
To back
to
it up,
back it
right?
up. Thank
No backup, right? Because CDC would push it forward and then it would go to the FDA if it's gonna go.
you.
But Chair, I would also, I think it's a good idea, but I think, I don't know when we were looking to do it, but I mean, it's gonna go hand in hand with when the federal budget finally does get approved and whatever that iteration of the version of it will look like, and the potential impact of what happens with all of the proposed Medicaid pieces. I had already shared with Donna the impact that it's already had on seniors, even with some of the stopgap stuff that they've already done, like SAMHSA, a lot of SAM agencies receiving SAMHSA funding has already been told that they won't be renewed. So that means they've already started to lay off. So there's the health, but it's the overall impact on economy, all of that, quality of life, everything. So I don't know how broad we want to make it because it can be dangerous if it's too broad. But I think we just need to, there are other factors that are going to be coming into play, like in the next couple of months.
And this is why we would need time, but also too, you bring up the point, again, going back to Donna Gill, the senior task force, if we're gonna do multiple, I mean, our seniors is a big slice of that.
Yeah.
And so, again, so I just wanna know what's the consensus moving forward? Is this something that we're willing to take on? It's up to us to advocate and educate our communities. Do the work.
Yeah.
Yeah, I think we have to, I mean, seniors are a pillar of our community and they have paid their dues, and it's really, I think that they're just not getting what they should. And the thing about it is everybody's gonna be a senior. So yes, we do have to advocate and act now.
Chair, I would agree, and you have 13 members in total in your committee. But if we're gonna do it, everybody needs to do the work.
Yes.
Because it always happens disproportionately. You know what I'm talking about.
I know what you're talking about.
All right, so that's my only concern.
We don't know.
Brian,
Yeah,
No, we just, in any group,
Yeah.
there are your
Some
laggards
do
and
the
there are your
work and some don't.
accelerators and there's those in the middle of, and we just need to make sure, because this is a big deal.
Yes.
And maybe it might be easier if you said we were looking at doing it with other
What
community
other
boards.
Entity, not
Oh,
community
okay,
boards, but
okay.
other entities
Well,
and stuff. So what, one of the proposed, like I said, is we're trying to look at, we can have it in different places. One place we're looking at is, is the hospital, Harlem Hospital, having it there, but we'll look at a church in the community, so there's a different.
senior center.
The senior center, absolutely, so this is where we gotta go, we can't just go to one place, expect to get everybody of those different cross sections.
I'm in.
Yeah, so one of the things that working with another organization, what we rolled out was What's the Facts? It was an interactive game, and we went into Lincoln Hospital to educate like those there about vaccines and getting the COVID as well as the flu shot and why it was very important. So one of the things that one of our challenges was that we didn't have anybody would speak Creole, but we had someone that spoke like Spanish and was able to communicate. So we have to kind of think about that when we go out into the community. But I'm for it. I just need to understand how what are the thoughts on how to roll it out?
That's something we have to discuss. We'd have to sit down and really do a plan.
And again, as I said, we're not gonna do this alone, we're doing this in collaboration, so, but I just wanna get us as a body to say, are we into doing this, because it's important. It's vital, because the ground is shifting every day as we move forward, in many different levels, and one level is health,
Yeah.
and the health of our communities. So,
And with that.
that's it. Anybody, Vice Chair? Anybody else have anything to add that's online?
No, I believe that we should move forward, but I'm also wondering about time, time to plan. What organizations are we co-planning with? And how are we marketing and promoting the town hall? So I'm just thinking about when are we now having planning meetings, because we don't want to half do it.
Well, those would be the next steps. So one, we would have to go back to the other organizations and say, hey, we agreed to come on, this is what we need to do, and these are the steps and everything and stuff like that too. So basically tonight is just, this is what we gotta do, get a vote to say, yes, we move forward to plan logistically to see how we can do this, and then we'll come back to the body with information. And then we move forward from there, because again, this is the last meeting before the break. But we can have a subcommittee meet, during the summer and so forth and so on, to get the information out and to move forward, so we move forward effectively. Does that sound like something we want to do?
Yeah.
Okay,
Yes.
we'll do that. Okay. Now, if there's no other new business, any announcements?
I want to add a new business,
Yeah, new business.
particularly for new members, but the committee in general. And when we return in September or late August, when we have our EC meeting, the district needs process will have officially started. So I'm recommending for the new board members to go on our website and review past district needs statements so that you can understand and see all the areas that it covers across, because when it gets started, it starts with a survey, then there are a series of meetings, and it moves fast and furious. I know it's gonna be in a committee now that's gonna lead it, but I just want to take the opportunity to read on our website past district needs statements, okay?
And what she's referencing, each committee in the past has had to submit additionally based on their area expertise, and submit it to, and there was a subcommittee that compiled all the different committees on the community board and put it together. But now we created a new committee that's no longer ad hoc, it's a standing committee called, is this change the name, government and budget.
And budget.
And budget.
Thank
We
you.
just renamed it government and budget.
Okay.
And so now the needs sector will fall under that, but that doesn't stop the work that the committees have to do in terms of forwarding and working with that committee who's now the official compilator or compiler of the information.
Yeah,
That's, thank you for that, because that's,
yeah, it's helpful.
yeah.
I have an announcement. Dominic,
Sure, please.
I talked too much this time. We're having a senior forum on some of these same issues, on June 25th.
I knew it was something happening, Georgia.
Yeah, I want to see if my screen will show it. It's not showing it. Juanita, do you have the flyer?
She just stepped out.
It's,
Yeah.
she said it's on the table. It's on. Hold on, Donna.
Okay.
Oh, this one.
This is the CEC flyer. No, that's
No,
not it.
no. It's at the Kennedy Center. On June 25th from 1 to 4 p.m. I'm hoping that the flyer is around somewhere because my camera doesn't want to show anything. But I just wanted everyone to be aware of that.
What time does it start?
It starts at 1 and it ends at 4. And it's at the Kennedy Center, 34 West 134th Street. And there's a QR code if you want to register, but you can also walk in. You got it now?
Yes, we have it. Thank you.
Okay, great. Thank you very much. I just wanted to.
Donna, are you still doing the CEC? Thank you.
The CEC3 or the C? Oh, I'm doing the people's money also.
Yeah.
I'm sorry. Yes, I don't have a flyer for that, but it should be there as well.
It's there. We have one.
The voting, the people's money, which is the citywide participatory budget. I'm
Sorry, Donna. Go ahead.
No worries. The citywide participatory budget, the mayor has given us $4 million to give to organizations in the 5 boroughs for programs. And the voting ends on the 25th. The reason I'm stressing it right now is because I had a meeting on Thursday and I realized that Manhattan's vote was very, very low. You can vote with the QR code. There are paper ballots if you need to, if I need to get paper ballots to you. But basically what it is, it's we fund different organizations that have programs for youth, for seniors, for young mothers. It depends on the program that the organization is going to design. And they get the money, the first set of money to implement the program. And we work with the new school so they can have longevity and it's not a one and done process. The money that we receive from the mayor, God knows it's not enough money to do the things that we need to do. However, the only mayor that's actually given us money is Mayor Adams, even though the CEC was a ballot initiative in 2019, I think. But prior to that, all the other mayors could not give money because de Blasio was right in the middle of COVID, and all of the money that was supposed to be used for it went to COVID. So we're asking for people to just vote on the programs. The programs have already been selected, and we just vote on which ones that'll work for the community. And you can just scan the code, it'll ask you your borough, and you just vote for the programs in your borough. Thank you. Thank you, Karen, for reminding me of my other hat.
You're welcome.
Any other announcement?
Yes, good evening. I have an announcement. This is Abena. How are you? Good evening, everyone. I don't know if you already received the information. Tomorrow evening, Harlem Hospital has an event that's occurring. Please excuse the background noise. It's called You're Invited Healing Harlem. Did you receive anything about that? I did just send an email to Juanita so she can have a copy of it. This event is from 5 p.m. to 8 p.m. and it will be at Harlem Hospital Center. There's a QR code on the flyer for people to RSVP. And this is in partnership with the NAACP NYCHA branch. And it again is tomorrow at 5 p.m. to 8 p.m.
Do we have that?
I haven't received the email yet.
And I apologize. I just received word of this earlier today. So please join for the evening. Those who are interested, and you can share it out as well. Special guests will be community leaders, health advocates, and local change makers. And special guests, also community leaders and health advocates. There'll be live performances, giveaways, and light refreshments. Thank you.
Thank you. Any other announcement?
Just one really quick one. July 31st, we're doing our second annual Menstrual Equity Summit at the school at 55 West 125th. Drop the flyer into the chat. It is for young people between the ages of 13 and 18. It is free, and we will have some of the leading experts in talking about menstrual equity, and there will be youth-led workshops by community peer educators. We're partnering with Team Pact, HEAT, and a few other youth programs. So if you have young people that day, please feel free to send them in our direction.
Thank you. Anyone else? Okay, going once. Going twice,
Can I say something about my YouTube channel again?
please.
Hello, everyone. I just want to encourage everyone to tune into my YouTube channel because, you know, I realize that people are watching YouTube more than television. And I know that I certainly do. And a lot of things that I see about people of color are negative. It brings you down. This stuff about Puffy is overwhelming and all of this other negative stuff. So I, Sheila Ennis, decided to create something to make people smile. It's informative. It's about fashion. I strut around and talk about Harlem with glamour style. But that is really not the premise of what I created. I created something called Closet Talk, where I go in my closet and I talk about health, hygiene, history, teeth, the importance of taking care of your body. The upcoming shows that I have, one is about high blood pressure and the effects that it has on men of color. So please, I know that this is a new channel, it's small, but remember that everything that's small now becomes big. I may become bigger than Oprah one day. So roll with me now, I'll rock with you later.
There you go.
And if you don't rock with me now, don't call me later. But tune into the channel because it's about positive stories. I'm passionate about people of color and I'm on a mission from God to uplift my community. So thank you very much. Thank
You're welcome.
Thank you.
And tell us the name of the channel
Oh.
again.
Harlemwood Glamour Style. Like Hollywood, but I am Harlemwood Glamour Style. Remember that name because it's going places. Thank you. Have a good night, everyone. Harlemwood. Never heard of that before? I've heard of Harlemwood. That's me. Nice to meet you
Well,
again.
thank you. Okay, I believe at this point,
I don't think we have a plan.
we have a call. 1, 2, 3, 4, 5, 6.
But only 5 in person, so we don't have a.
Oh, that's right. Yes, okay, so our meeting is now adjourned. Thank you for coming out. I appreciate everybody. Thank you for your input and intellect.
Same here.
Have a blessed evening and happy Juneteenth in advance.
Good night.
Yes, good night,
Enjoy it in a
everyone.
positive way.
I can't get it. Turn it off.
Good night.
I know you gotta go do what you need to do.
I'll see you at the save here.
Huh? No, here. They ran out of popcorn.